If you break your leg, you go to the emergency room. The doctor takes an X-ray, and the path forward is universally understood. You do not get a notebook and instructions to journal your pain for 3 years. Yet in severe psychiatric care, that exact wait-and-see guessing game remains the accepted medical protocol. The reliance on observing outward behavior creates a massive timeline of failure. On average, a patient will cycle through ineffective treatments for 5 to 10 years before doctors accurately identify the biological cause of their illness. During those lost years, the underlying disease actively worsens. What we call psychosis is an acute neurotoxic state. As the brain is flooded with a toxic imbalance of neurotransmitters, the gray matter actually thins out, and the delicate synapses wither away. Because traditional tools couldn't safely access the living brain, the medical field retreated to clinical observation. By waiting to see how a patient acts instead of treating the cellular crisis, the current system allows compounding, irreversible brain damage to occur in plain sight. This animated diagram shows the macroeconomic fallout of that decade-long delay, visualizing the $366.8 billion annual burden that schizophrenia places on the U.S. economy. That $104.6 billion represents the lost productivity of family members who have left the workforce to provide full-time care. Behind that number is a mother or a father walking into their boss's office to resign. They surrender their careers to stay home and make sure their adult child doesn't wander into traffic or succumb to terrifying hallucinations. Without a precise biological target, the medical burden shifts to the home. Families spend years acting as manual around-the-clock observation systems, filling the gap left by a diagnostic process that currently relies on tracking behavioral relapses over several years. Doromind intends to replace that decade of trial and error. Their initial objective is to compress the diagnostic timeline from 10 years down to under 30 days. This animated diagram shows how they achieve that using the Laguna mRNA panel. When the brain is under extreme stress, it sheds microscopic envelopes called vesicles directly into the peripheral bloodstream, where a standard blood draw can capture them. Unlike a static DNA test, which only reveals your genetic blueprints, measuring mRNA shows the active cellular work orders. It proves that a specific neurotoxic process is occurring in the brain right at this exact moment. Once the diagnosis is locked in, the protocol deploys a targeted weekly injection, known as the CAD1 synaptic peptide. Standard antipsychotics act as heavy chemical sedatives, blanketing the entire brain to suppress dopamine and halt hallucinations. CAD1 takes the opposite approach. It operates as a highly specific synaptic fertilizer, resupplying missing proteins to help the brain regrow its electrical connections. Marrying an accurate blood biomarker with a targeted regenerative peptide moves the standard of care away from simply numbing a patient's mind. The focus shifts directly to debugging and repairing the broken neurological hardware. Even the most perfectly engineered medicine fails if a highly paranoid patient refuses to take it. Expecting someone in the middle of a severe psychiatric crisis to maintain rigid daily pill compliance guarantees failure. To remove the burden of remembering entirely, engineers developed a structural delivery system. It centers on a standard-looking pill containing a gastric star polymer. This diagram illustrates the mechanics of the polymer inside the body. After the patient swallows the capsule, the outer shell dissolves in the stomach acids, allowing the rigid star shape to unfold. Because the star is too wide to pass through the pyloric sphincter, it safely anchors in the stomach and slowly releases medication for up to a month. We can look at diabetes treatment in 1975 to understand why this matters. Back then, patients relied on crude animal-derived insulin and rough estimates of their blood sugar, making treatment incredibly dangerous and hit or miss. Modern diabetes care solved this with continuous glucose monitors that talk to automated insulin pumps. Doromind applies this exact logic to the brain by developing a continuous remote monitor, essentially a glucometer for the mind, that tracks psychiatric enzymes and medication levels in real time. Combining a gastric polymer that automatically delivers the drug with a monitor that reads the body's chemical state removes human error from the equation. It establishes the first fully automated, closed-loop medical system for severe mental illness. Implementing a continuous biological monitor directly impacts the family unit trapped in crisis. Instead of waiting weeks for a visible behavioral breakdown to realize a medication is failing, doctors see the chemical imbalance instantly on a dashboard. Clinicians can adjust dosages precisely based on that real-time data, bypassing the need to constantly watch the patient for signs of a relapse. Automating the monitoring process allows family members to step back from full-time surveillance and return to their own careers. On a macro level, this system targets the root cause of the $104 billion in lost wages by restoring the workforce participation that a decade of diagnostic uncertainty currently prevents. Looking ahead to the 2040s, the roadmap leaves symptom containment behind entirely. As biological data accumulates, the medical field will divide schizophrenia into precise, curable biological subtypes. This animated diagram shows a treatment for patients with a specific genetic mutation. Synthetic strands of nucleic acid, called ASOs, act as molecular whiteout. They hunt down and physically neutralize the faulty messenger RNA sequence before a toxic protein can ever be built. For the highest risk cases, scientists plan to use CRISPR base editing to perform pre-symptomatic interception. By rewriting the faulty genetic code in a teenager's brain years before their first hallucination, the disease is stopped before it even begins. When we address the brain with exact biological mechanics, a psychiatric label ceases to be a lifelong boundary. By abandoning the clipboard and embracing precision molecular engineering, we ensure conditions like schizophrenia become a closed chapter in medical history.